Many of us have had to spend a few nights in hospital. Most people at some time in their lives will need some kind of treatment. When we stay in a healthcare facility, lots of roles are involved in making that stay possible and in successfully dealing with our health needs. A mixture of medical and non-medical staff ensure we are looked after.
My name's Jessica and I'm a healthcare assistant. Make beds, transfer patients, take them for scans, give them a wash, feed them if they need help. Just make sure you just keep checking on them and see if they need anything and just do what you can to help them really. I like my job because I get to talk to people, you get to see them come in when they're at the worst and then they leave at the best, which is lovely. Well, before I did this job, I was a business admin apprentice in theatres at this hospital. Then I realised I wanted to become more clinical, so I was looking and applied for clinical roles. Yeah, the support is really good here, so if you ever feel like you need to talk to someone or if a traumatic event has happened, you always have a debrief after, or there's always someone you can go to talk about it, which is nice. There's a few things that are quite hard, so obviously all patients can deteriorate quite fast. And sometimes they do pass away and it is very, very hard. It's not nice to see. But after that's happened, the support from your colleagues that you have, if you didn't have that, you would really struggle. But it's nice to know that if something does happen that's traumatic, you do have support there. Next, I would like to do my nursing, I think. I'm still torn, I still really don't know what I want to do. I know I want to work with people, that's my goal. But I would like to do my nursing eventually. Just do it, even if you come to it and realise it's not what you want to do, at least you would have had the experience and you can see what it's like on the other side, because from being a patient to being staff, like I know, it is so different and you get to appreciate what the NHS actually does for people. Because I think until you work for them, people just give it a bad name, but they don't realise how much hard work goes into working in healthcare.
My name's Jo, I'm the clinical lead for Fraility at Warwick Hospital. Frailty is technically NICE guidelines say anybody over 65. We see people over 75 and it's about patients that come in with, you might be a quite well 75-year-old and then you get a UTI or a chest infection. That infection can cause some issues with mobility or not knowing where you are, so sort of like a delirium. And it's about getting them over that period to try and get them back to as normal as possible so that we can get them home. And you can have very mild frailty to really quite severe frailty where you become sort of really quite unwell. And it's about helping those patients through that pathway and then identifying the risks going forward. It's all I ever wanted to do. I couldn't tell you what pinpointed it, maybe childhood experience. I spent a lot of time in hospital as a child, but I always knew I wanted to be a nurse from the moment I sort of left school. That's all I wanted to do. At school, actually, I failed really badly, so I only got one GCSE the first time round. So I had to leave school and go back to college to redo my GCSEs. And I did the pre-nursing course at Warwickshire College at the time, which was attached to GCSEs. I got my 5 GCSEs then, and so then applied to any and every university that took GCSEs only, because they were starting to move away and onto A-levels, but managed to get into Sheffield University. And then did my advanced diploma training for the 3 years, and I actually stayed for another 9 months afterwards and did a top-up degree at the end of that, so I still managed to get my nursing degree in the end. I never planned on leaving A&E. I left for personal reasons. I've had a lot of surgery on one of my knees, which meant working clinically the way that a lot of nurses do became really difficult. So, I mean, my job now is more office-based, and I did 5 years service improvement as well, so I worked with IT companies putting in digital programs to help with healthcare. So like I said, in that time I've built up a lot of skills, and it was about using those skills. Where I go from here, actually, I've got to think about, because there are a lot of opportunities and it's which way do I go. I think the main thing is that healthcare is really, really varied. I went in as a nurse and I've done nursing, I've done major incident training, I've done chemical and COBRN training, I've done minor injuries, I've also done IT implementation, and now I've gone back to sort of more team working around the nursing culture. I think the main message is that it is really varied. It isn't necessarily just working on a ward, and that there are lots of options, and there are lots of routes in now. If I wanted to be a nurse today with the GCSEs that I left with, I wouldn't be able to do it, but we offer apprenticeships and other ways into into the hospital.
My name is Jodi Robinson and I'm an operating department practitioner and I've only just qualified. So my main role is to work as a scrub nurse in theatre, assisting surgeons, and working as an anaesthetic practitioner, assisting the anaesthetist, and also working in recovery. So I went to university. I already had my grades to go to university, so that's what I did. Well, I did think that I wanted to be a nurse, but when I thought about it long and hard, I decided that I didn't want to be based on wards, so that's why the operating department practitioner role was more suited to me. So you need to have your maths, English, GCSE at C and above, and you also need to have some sort of access. You need to do your access course, or you already need to have 5 A-levels. Well, hopefully a positive impact, because you're assisting them from the beginning to the end of their recovery while they're coming in to have an operation. It makes you feel good because obviously you've been able to help them during their period in hospital. Sometimes when the lists don't go to plan, or patients get cancelled, or the kit's not available that you need for a certain operation, things like that. So you overcome those by working together as a team to get the best outcome for the patient. So I'd like to hopefully develop my role even further and maybe one day become a band 6 or maybe do something along them lines. The NHS is a really good place to work, and also there's really good benefits from working for the NHS, helping people and developing yourself further with continuous learning and development.
Hi, my name is Prap. People call me Prap here. I'm a theatre apprentice. I normally work around theatres, but I've also experienced, thankfully to my managers, the ward and also the CCU. So I normally help circulate around theatres, help with the other sport workers in the ward. I'm actually from India. I was born there, came here, went to primary school, went to secondary school, then did my A-levels, and while doing my A-levels, one of our career advisors asked me, what do you want to do? Whenever I went into a hospital, I was always so impressed by the service I was given. And so I thought I would want to work in healthcare. And so I started looking up into my career options in my second year of sixth form and found out about this apprenticeship. And from then on, I just said, you know what, let me give it a try. University was an option for me, but I did not want to do it because I was just tired of education. I wanted some practical experience. And luckily, because of this, I've got some education as well as practical experience. And now I actually know what I want to do in the future. Patients, if they have a smile, sometimes they don't even say anything. If they're healthy, they're happy, that's what I think matters the most. My message would be, look at every option. University is not just the option. You have to focus on yourself, not what other people say. University could be for you, and sometimes it is for you, but experience is something else. I didn't know what to do, and I applied for university. I got into a lot of universities. I got into Birmingham City, I went going to Coventry, but I wasn't exactly sure, and this apprenticeship I found out about, and so when I went here, and now I know what I certainly want to do. I was unsure, and now I know that I want to go in healthcare science, I want to do cardiophysiology.
My name is Jairix Monsera. I'm known as Rex. I work in 21 Gastro. I'm responsible with my team, my staff that I manage. Patient safety is one of our main priorities, so like dealing with complaints, current issues, and training. I came from a family of medical professionals, so initially wanted to do social working and IT, but I think that time my dad convinced me eventually to say, oh, why don't you try nursing, because it's free and they had bursary at that time, so it was convenient for me. So when I started doing nursing, it kind of found me as a career-wise, so I began to love the course and love the career, and it ended up being a passion. I think it's something that I was born to do. For young people or young individuals who wants to join healthcare, I'd encourage you to do it. There's a lot of learning opportunities available for you, and it's something that you journey along with us, because You'll be guided by trained professionals, and obviously your teachers are equipped with like knowledge on how you can progress on your course to do nursing or any healthcare professional. So but like there's quite a wide range of job opportunities that awaits for you upon completing the course, and it is something that work is always there. Career-wise, you'd be secure in terms of like future. There's always a job for you.
In the role of a clinical support officer, you have to be both admin and clinical trained, so that you've got some experience in both environments, so that you have a level of understanding of what the role intakes, because you would be taking audits from the wards, training the staff on the wards, and also taking data and keeping track of all the systems that are in place. I like enabling the staff so that they're delivering the right service on the wards, and I like training the staff. I also enjoy doing work placements which I put on the wards, and hopefully developing our current staff and future staff. Within the trust, obviously, all teams are different, but we have team dynamics, and we're all different, which is good because we all have different backgrounds and experience to offer to each other. And also we come from different age groups, so I think you can always be educated from the youth that come into your team, and also you can gain experience from the older staff that have been here a while, so we work well together. I believe that working for the NHS has helped me to develop and grow, and I've enjoyed every part of my journey. I think you should never think that you're not good enough to do something, and whatever qualifications you've currently got or are hoping to achieve, you can do throughout your life. I didn't do my degree till I reached nearly 40, and it was the best thing I ever did, and I did it while having 3 children, so nothing can stop you if you want to do something.